All right, so without further ado, I think I now have the privilege of introducing the Associate Administrator for the HIV/AIDS Bureau within HRSA, Ms. Heather Hauck, as probably many of you guys already know. So in addition to being the Associate Administrator of the HIV/AIDS Bureau, she provides, in her capacity, provides leadership, technical expertise, and resources for the administration of the Ryan White HIV/AIDS program and the Ending the HIV Epidemic Initiative. She has served as the HAB Deputy Associate Administrator from 2016, and then prior to that, the Director of the HIV/AIDS Bureau Division of State HIV/AIDS program, where she began at HRSA in 2012. Prior to that, she was the Director of the Maryland Department of Health, Infectious Disease, and Environmental Health Administration. And before that, she was the Section Chief at the New Hampshire Department of Health and Human Services Division of Public Health, STD/HIV Section in Concord, New Hampshire. And finally, before that, she was co-director and the HIV social worker at the Washington Hospital Center Social Work Department in Washington, D.C. So without further ado, Ms. Heather Hauck.
I started when I was 5 years old.
Good afternoon, everyone, and welcome to the 2025 Ryan White HIV/AIDS Program Clinical Conference. My name is Heather Hauck, and I'm the Associate Administrator for HRSA's HIV/AIDS Bureau, and I am delighted to be able to join you for this annual event that brings together Ryan White Program clinical providers to share clinical and scientific updates, lessons learned, and best practices. As has already been shared, it is really exciting that we have over 525 attendees this year, with about 185 of you who have never attended this conference before. So again, welcome to the conference, and welcome for those of you who are new to the Ryan White HIV/AIDS program team. I definitely want to start by thanking our three clinical conference co-chairs, Drs. Janelle, Sag, and Gail, the National AETC Support Center staff, and the IAS-USA team who thoughtfully curated the content of this conference for you all. I also want to acknowledge our HAB clinicians who are attending the conference this year. As always, we'd like to begin by sharing our HIV/AIDS Bureau mission and vision. As you may imagine, it has been an unprecedented year for the HIV/AIDS Bureau, and we appreciate our Ryan White program's providers and grant recipients' flexibility as we continue to implement such an incredibly important and impactful program. We in the HIV/AIDS Bureau focus every day on the fact that because our program exists, people with HIV who otherwise could not access medications or treatment are getting HIV services that help them manage a chronic disease and prevents forward transmissions. Next slide. It has also been a busy year for the HIV/AIDS Bureau. This summer, we commemorated a significant milestone. On August 18th, HRSA celebrated the 35th anniversary of the historic legislation that created the Ryan White program. The Ryan White Comprehensive AIDS Resources Emergency, or what we refer to as the CARE Act, was signed into law on August 18th, 1990. And again, that created the federal program that provides care and treatment services to people with HIV. As you all know, when Congress passed the Ryan White CARE Act in 1990, the HIV epidemic looked vastly different than it does today. And over the past 35 years, the reach and the impact of the Ryan White program has continued to grow. So to demonstrate that, you are the first to see our brand new 2020 Ryan White HIV/AIDS program annual data, which will be released later this week. We are so excited to announce that the latest data show that the Ryan White program served an unprecedented nearly 602,000 people in 2024, which is over half of all people diagnosed with HIV in the United States. Again, helping them live longer, healthier lives, manage their HIV as a chronic condition, and preventing forward HIV transmissions. This was an increase of almost 25,000 people from 2023. And while I can't directly attribute the increase to the work being done in the Ending the HIV Epidemic in the U.S. initiative, I certainly think there is a strong correlation between that work and these numbers. We are also excited, as you can see in the middle of the infographic, to share that in 2024, a record-breaking 91.4% of patients receiving Ryan White program medical care are virally suppressed, which is up from 69.5% in 2010. And that is something that we should all be very proud of. In addition, the program continues to have a critical role in improving HIV health outcomes as we continue our effort to end the HIV epidemic in the United States. And we continue to support people aging with HIV. And as you can see on the far right-hand side of the slide, more than 47% of our clients served by the program were 50 years or older. So again, a testament to the work that you all are doing every day and the work that is being done across the country to support our aging clients with HIV. Next slide. On this next slide, you can see how the Ryan White program viral suppression rate in 2024 compares to the most recent data from the CDC, which is among all people diagnosed with HIV in the United States. So obviously, our 2024 rate of 91.4% is significantly higher than the 67.2% national viral suppression average. So again, a testament to the work that you all are doing. Next slide. So the improvements in viral suppression are again, the result of many years of hard work to close gaps in access to care, to provide whole person care to patients with HIV, and to increase the number of clinicians providing HIV care treatment. We like to show this slide because the maps show us the variation in viral suppression by state. On the left-hand side of the slide in 2010, when we first started collecting data on health outcomes and our client characteristics, and then on the right-hand side of the slide, in the lighter blue, indicating the progress that has been made in every jurisdiction across the country up to the 91.4% in 2024. And as you can tell, while all states showed increase in viral suppression over this time period, some states, particularly in the southeastern and southern part of the United States, continue to have room for improvement. So we monitor this data carefully and really continue to work with all of the jurisdictions around improving viral suppression. Next slide. So I also want to share some of our new data resources with you all that you may not have been able to step out of clinic and participate in our Have You Heards to see these. So just last month, HRSA's HIV/AIDS Bureau, we released the Ryan White Program AIDS Drug Assistance Program, or ADAP, annual data report in 2023, as well as the latest 2023 ADAP data infographic, which is on the next slide. As many of you know, every state has a Ryan White Program ADAP, which makes HIV medications available to people with HIV with lower incomes. And the ADAP services can include paying for either HIV-related medications, assisting with the cost of medication copays and deductibles, or purchasing healthcare coverage for eligible clients, or at any point in the year, they may be providing all of those services for a person as they move through their jurisdiction's eligibility process. Next slide. So in 2023, Ryan White Program ADAPs served more than nearly 310,000 people with HIV. And again, this was an increase of about 19,000 clients compared to 2022. Again, I can't directly attribute this increase in the number of patients to the work in the EHE. But again, we really think that this points to the evidence that the EHE initiative is accomplishing its goal, which is to get people with HIV who are newly diagnosed or diagnosed but not into care. We also point out in the infographic that more than 13% of clients in 2023 were newly enrolled in the ADAP. So again, evidence that EHE is working. And like our annual Ryan White Program overall report, the ADAP report also presents client characteristics, demographics, socioeconomic factors, and service utilization among clients served by the ADAPs. And this report includes data from 2019 through 2023 nationally, and then we also have tables broken down by state and territory. Next slide. And then back in August, we also released our latest 2023 Ryan White Program AIDS Education and Training Center, or AETC, program annual data report and infographic. So you all know, because you're part of the team, that the AETC program works to increase the size and strengthen the skills of our HIV clinician and non-clinical workforce to improve outcomes along the HIV care continuum, decrease HIV transmissions, and reach people with HIV who are out of care or not virally suppressed. This particular report presents data for training events and event participants reported by the AETC program recipients, the regional recipients, for the reporting periods between July 2018 through June 2023. And just as a reminder, our AETC program is the only part of the Ryan White program where we have statutory authority to work in the HIV prevention and the syndemic space. So they can train on HIV testing, hepatitis, substance use disorder, STIs, et cetera, in addition to HIV clinical care. Next slide. So to complement the brand new AETC annual data report, the HIV/AIDS Bureau also released another infographic, or what we call by the numbers. And so you can see on here from July 2022 through June 2023, our regional AETCs conducted over 10,000 training events, reaching over 54,000 healthcare providers with HIV prevention and HIV care and treatment content. So we know that this report only represents a snapshot of the workforce who are supported by the AETCs. For example, what's not reported here is that from June 2024 to May 2025, more than 520,000 learners from across the United States viewed our AETC national HIV curriculum. And we have thousands of calls to the various warm lines and hotlines of the National Clinical Consultation Center each year, which again is not represented in our by the numbers infographic, but is certainly a part of the story of the AETCs and the impact of the AETCs. Next slide. In addition, on this part of the infographic, we highlight the critical topics in HIV care delivery that the AETC program training events addressed, which includes everything from HIV diagnosis, linkage to care, care coordination, and antiretroviral adherence, and really also digs deeper into the participant makeup of our AETC training. So again, a depth and breadth of the AETC program. Next slide. And then finally, in terms of data releases, we also last month released our new 2023 HIV/AIDS Bureau Ending the HIV Epidemic in the U.S. Initiative Data Report and Infographic. So next slide for the infographic. So as you can see, and this is a busy one, as you can see in 2023, our EHE-funded providers served more than almost 27,000 clients new to HIV care, and over 17,300 clients estimated to be re-engaged in care. And this is a steady increase over the years since the start of EHE implementation in 2020. And this is incredibly important, and I'm going to show you some data on this in a couple of minutes, because according to new CDC data, it's that 87% of all new HIV transmissions come from the 34% who are not aware that they have HIV or who are not receiving care. So really reaching these numbers on our EHE initiative are critically important to ending the HIV epidemic. So not only our EHE providers serving more new and out-of-care clients each year, they've also expanded to serve clients facing complex needs that find traditional systems of care inaccessible. And you can see at the bottom of this infographic, we pull out a couple of the things that we know are working out in the EHE jurisdiction. So obviously training our workforce, I already just talked about with the ATCs, expanding access to services, including housing, transportation, telehealth, low barrier clinics, mobile medical units. Delivering rapid ART services is important, and supporting client navigation through community health workers and peer support. And that's just a snapshot of some of the things that we know that are working out there. Next slide. And because of the work that they're doing out there, you can see in this part of the infographic that by the end of 2023, if somebody entered into care by the end of the year, 81.4% of patients who were new to care and receiving HIV treatment reached viral suppression. So again, if somebody comes into care, walks into care and starts medication, even within 1 year, we're able to get the majority of folks virally suppressed. So again, a testament to the work that's being done out in EHE. The other part of this infographic, which we like to point out, is we really are reaching the people that we're supposed to be reaching in EHE. So compared the new clients, which are the red bars, compared to our overall population in the Ryan White program, we're reaching folks who are younger than 34 years or younger. We're reaching folks who are unstably or temporarily housed. We're reaching folks who are at or below a 100% of the federal poverty level, and we're reaching folks who lacked healthcare coverage. So again, finding those folks that we need to be finding and getting them into care so that they can reach viral suppression. Next slide. This is, again, just a snapshot of some quotations from our EHE work, as well as some things that we know are working. They are recipients out in EHE because there's a little bit more flexibility with this funding than with regular Ryan White funding. They are really applying responsive and tailored approaches to help overcome barriers to care and meet the specific needs of people with HIV in their jurisdictions who won't or can't access traditional care systems. So as I've already mentioned, rapid ART programs, community health workers, they're also really able to help with additional housing, transportation, et cetera. Again, amazing work going out there in the EHE jurisdictions. And in a second, I'm going to talk about why we want to bring what we've learned in the EHE initiative to scale across the Ryan White program. Next slide. So that is the beginning of this part of the presentation. So all of the data that I just shared, plus around EHE, plus the combination of the 35 years of experience as the Ryan White program is why we introduced Ryan White Program 2030 earlier in 2024. Next slide. So the reason we did that, and as I just shared a few minutes ago, since 2020, we have witnessed viral suppression among people receiving HIV medical care through the program climb from 69.5% to 91.4% in 2024. And again, that is a testament to the incredible progress is thanks to the work that you all do every single day, providing whole person care to people with HIV across the country. But despite the gains in the program, as I just mentioned, about 87% of new HIV transmissions are estimated to result from the 34% of people who are either undiagnosed or not engaged in care. And that is why we really have called on the Ryan White program community to focus efforts on reaching those who are out of care or undiagnosed, because that is how we're going to end the HIV epidemic, is by reaching those folks and making sure that they reach viral suppression. And don't forward transmit. So the Ryan White Program 2030 framework is really a forward-looking framework designed to sustain the high-quality care and treatment for current Ryan White Program clients, while also expanding efforts to reach people with HIV who are undiagnosed or out of care. And the rough estimate is that that population of undiagnosed or out of care is really around 220,000 people. So that's the group of folks that we are asking everyone across the Ryan White program to focus on. And again, building on what we know works, because we've been doing this for 35 years and obviously have great health outcomes in the program. And in the past now moving into the 6th year in the EHE initiative, we also have additional evidence of things that work to reach folks who haven't been able to engage in HIV care and treatment previously. Next slide. So this is the slide I talked about a few minutes ago. This is the recent data from CDC. They did updated modeling with 2019 numbers. And as you can see on the right-hand side of the slide, the 87% of new transmissions, and on the left-hand side of the slide are coming from the 34% of people who are either unaware of the HIV status or aware of HIV, but not in care. So again, closing those gaps is critical to reducing new infections and ending the HIV epidemic. Next slide. And so we've been really thinking about, well, how do we get there? How do we find the 220,000 people and interrupt those forward transmissions? And so we know that the three key strategies in order to do this work is strengthen and expand partnerships. And really that's because the partners that we've had for the past 35 years have been fantastic, and they've gotten us where we are today. But to reach that additional 220,000 people, we're going to need new and different partners at the table who can help us find those folks and engage them in care. And again, so a lot of that work has already started happening. We also know that we need to prioritize community engagement. All of you know that in the Ryan White statute, it's actually a requirement that we have community engagement. We're required to have planning councils, planning bodies, community advisory boards. And so we have a long history of engaging our community, and we need them at the table so we can understand what works and what doesn't work to reach people with HIV who are out of care. And we also know that we need to implement focused interventions. And sometimes that means we need to let go of some things that we've been doing that we know aren't working as well for this population, and then to implement using an implementation science model to implement focused interventions that we know are going to be able to work with this population. So we know that this is not a new concept in terms of focusing on reaching people who are out of care. It really is a continuation of the work that our recipients, you all, have already been doing for many years in your jurisdictions. We just want to build on that work and again, reach the folks who are not engaged in care so we can stop forward transmissions and end the HIV epidemic. So you will be hearing a lot more about Ryan White Program 2030. You've heard it a lot over the past year, but a lot more as we begin to implement these activities and these strategies as we move forward in 2026. Next slide. So just a couple of Bureau updates. As I said at the top, it's been an incredibly busy year in the HIV/AIDS Bureau, but really want to underscore a couple of housekeeping type things before I close. Next slide. So this is kind of a boring one, but I wanted to make sure that you all heard this directly from us. So we talked about this in a Have You Heard, but again, I know you all are busy clinicians and may not have been able to step out to hear this very grant-specific update. So the U.S. Department of Health and Human Services fully adopted 2 CFR Part 200 on October 1st. Which rescinds the old CFR, which was 45 CFR Part 75. And as part of that transition, HHS also issued a new grants policy statement, or GPS, which was also effective October 1st. This new grants policy statement applies to all discretionary awards with funds and award modifications made on or after October 1st. Again, as clinicians, you may not be involved in the day-to-day operations of the grant side of the work. However, many of you may be listed as the project director or the PI on our notice of awards or on our grants. And in that role, you should definitely make sure that your operations and budget leads are paying attention to these changes, as there are some pretty significant ones in the updated 2 CFR. So definitely make sure to read your notice of award. Make sure that your folks who handle your grants policy type related things are aware of what the changes are and are paying attention to those changes. And this is a blanket statement in all of our NOAs. As a reminder, all HAB recipients are required to comply with the laws, policies, and terms and conditions that are included in your notice of award. And the GPS, the grants policy statement, is incorporated by reference in your notice of award as a standard term and condition. So again, just check your NOAs frequently to make sure that you're in compliance with all the terms and conditions, because we do, as things have evolved over the past year, we have been updating the terms and conditions, and I don't want you all to be surprised by anything that's on your notice of award. Next slide. So we are very excited to announce that the 2026 National Ryan White Conference on HIV Care and Treatment will take place this summer from, next summer actually, from August 4th through the 7th, 2026 in Washington, D.C. at the Washington Hilton. As with our previous conference in 2024, the 2026 event will use a hybrid format, which incorporates in-person and virtual learning opportunities for participants. For those of you who were able to participate in the 2024 conference, because it was actually a hybrid model, we were able to have over 7,000 people participate in the conference, which is fantastic to be able to reach that many folks. The in-person participants, because of space constraints in the hotel, we can only have about 3,500 in-person participants. But again, there's the online option if that's more convenient for folks. So we did launch our conference website And at the same time, on November 24th, we opened the abstract submission period. So there's still a limited amount of time to submit an abstract. It will close December 29th, 2025. Next slide. So the conference theme we also announced about a month ago, which is building on 35 years of care, which references the Ryan-White Care Act, strengthening our foundation and advancing access to end the HIV epidemic. So with this theme, we are paying tribute to a critical milestone, as I've already talked about, the 35th anniversary of the Ryan-White Care Act, as well as the fact that we are advancing access to end the HIV epidemic and strengthening the foundation of the program, of the overall program. So for those of you who are able to make it, it's a fantastic conference just like this one, and we hope that we will see you there in August. And then finally, next slide. We have been doing over the summer and over the fall, we actually have been having a series of 10 in-person and virtual community engagement listening sessions, specifically focused on our Ryan-White program parts A and B planning councils and planning bodies, the chairs and the members in jurisdictions throughout the country. We have done these listening sessions in 2019, 2021, 2023. This series of listening sessions has provided us with an opportunity to hear from those who are involved in the planning, development, and implementation of HIV care and treatment strategies with a specific focus on people with HIV who are out of care or undiagnosed, basically in order to inform our Ryan-White Program 2030 work. We thought it was critically important to hear from folks on the ground about what was working and not working, so we can again focus our efforts on the not diagnosed or diagnosed and not in care. We actually just concluded our final session this past Thursday in person in Dallas, Texas, and I really want to thank everybody who participated in these sessions throughout the summer and the fall. We had great turnout and really, really great participation. What we do with these listening sessions once we've concluded them each year is we roll up the themes from the sessions and then we share them back out with the field in a future Have You Heard? So we'll be doing the themes from this year's listening session in early 2026 in one of our Have You Heards. Next slide. So we always like to share our contact information and share how you can connect with us. I know that many of you are very busy seeing patients and may not be able to step away for our monthly Have You Heard webinars or other technical assistance content that we provide. And we have technical assistance content pretty much every week on various topics or things, but I want to make sure that you know that those resources are available and that we provide them to make sure that you are up to date on policy, program, clinical, quality management, data, best practices, peer successes, etc. So if you don't already get our biweekly newsletter, please do sign up for the notification so that you are aware of what all we are offering and can connect to those resources as you have time for or as needed. So I want to, again, thank you for the opportunity to share these updates and for all of your continued efforts to provide care and support services to people with HIV across the country. We in the HIV/AIDS Bureau are so proud of our partnership with you all as we continue our mission to end the HIV epidemic. Thank you.